Now, Limpopo's health department has intensified its screening of migrant farm workers following the detection of 2 cholera cases in all days north of Polokwane. 2 Zimbabwean nationals were diagnosed with cholera 2 weeks ago. One of them has since been discharged from hospital. Shortly, we'll be speaking to the MEC from the Limpopo government. We now know that this is linked to Zimbabwe, currently battling its worst cholera outbreak in more than a decade. You'll remember in 2008, and this is why authorities are very jittery. In 2008, 4,000 people died, and in the latest cases this year, more than 50 died. Authorities thought they had the cholera outbreak in Zimbabwe completely under control, but now we're seeing more and more cases, mostly in a border town with Mozambique. Let's see if he's on the line for us, the MEC for Health in Limpopo, Dr. Phophi Ramathuba. MEC, thank you for being with us. Firstly, what is the condition of the 2 migrant workers diagnosed with cholera so far?
The conditions, good evening and evening to all your viewers. What we can reassure you is that the condition has been stabilized. They are both doing well. We were just left with 1 or 2 things that after shall have been corrected, especially on the electrolytes, then the doctors will be able to discharge them.
We're clear that both of them went to Zimbabwe and brought this back, as it were. There's no cholera, waterborne cholera in Limpopo itself.
We don't have any case of cholera that has been found in Limpopo. You'll remember that in September, when we had an outbreak in Zimbabwe, as a province, because we know we are bordering Zimbabwe and South Africa, we did an outreach where we moved to the border and also strengthened our port health system by deploying even professional nurses. We worked with the South African National Defence Services. We worked with our municipality, environmental practitioners. We've done the water testing ourselves because we've been facing challenges with the Department of Water Affairs, but we did a lot of testing in our rivers and a lot of campaigns to talk to our community. So, and make sure that we screen everyone who enters. But unfortunately, the challenge becomes that we can't control who comes to South Africa and who doesn't, because not everybody uses the legal route. People come on their own way. Not everyone is legal in the country, but unfortunately, diseases do not choose to say you came legally or not. That is why, as a department, our main worry is that everybody who enters the country, whether legally or not, we must be able to screen that person, must be able to take through our clinics. So yes, we can confirm that as a province, we don't have any case of cholera, but however, these 2 migrant workers who have visited their home village recently, when they arrived, they came back. And we want to thank our clinic nurses, because both cases were diagnosed by all-day clinic professional nurse symptomatically. We only did at a hospital level the confirmation. So meaning our campaigns and also the training of our nurses in our clinics, all our local clinics, they are now alleged and they are now vigilant. They know that any diarrhea suspect must be treated as if it's a cholera and must be referred urgently.
So the problem is you get diarrhea and you can dehydrate very quickly, but otherwise it's highly treatable. So you're saying Limpopo hospitals are well equipped to respond quickly to any cholera cases?
We are able to respond. We are able to respond. We have trained all, especially those who are working in their private as independent practitioners, because that's where you tend to miss some of these cases. But we've already trained them to say, any diarrhea suspect, let's treat them. What it's giving comfort to me is that we are having so many report cases to say we've got an alleged suspect, we've got so many suspects, which we end up not confirming. So the more you have a number of cases being reported as suspect and testing negative, it shows you that your health professionals on the ground, it shows you that the work you are doing to the community on the ground, they are aware that there is cholera. Yeah. That is why they are reporting more cases.
Although
which are not even cholera. Yes.
You said you wanted everyone screened coming into the province. Let's just be clear, these 2 Zimbabweans, I understand, were legal migrant workers. How on earth are you going to screen illegal workers coming in?
This is what we are saying, that the challenge becomes that people come through even, we don't have a fence. I've gone there to the border. I've tried to drive around the Madimbo. It is a problem. That's why we have requested the South African National Defence Force that they must start assisting us with the patrolling, especially now we're getting into festive season. Most of the migrant workers, they are seasonal workers. They will be going home for their festive. When they come back in January, we should be expecting a lot of influx that might not be coming through the border. So what we are doing is to work with the other law authorities. We're working with the Defence Force. We're working with the police, such that when they patrol and they pick up some of this, it's not only about deporting, it's not only about arresting. Let the person be taken to our facility. And our message to the farm owners, who some of them are employing this illegal. We were having difficulties the past week when we wanted accessibility into some of these farms so that we can do our health job. But I can proudly announce that today we managed to meet with the Agri-Forum chairperson of Capricorn District. We will be meeting them. We've got all the dates between now and Christmas. We will be going from one district to another, meeting all farm owners, teaching them, explaining to them.
I think we should be very clear that people know they don't need to be afraid of Zimbabweans. We don't have this in our waters. And can you confirm that there's not a high risk of this being passed on person to person?
No. We need to be clear and be honest. Some of the farms that we visited, there were no ablution facilities. And this is where a farm where in one of these farm workers is working in. Now, that tells you that if you have a farm worker who is not utilizing ablution facilities, chances of that person to spread cholera to the other farm workers and even to the farm owner are very high. Because cholera is a hygienic condition. You pick up your vegetables, your gardener goes to the bathroom, doesn't wash their hands. They go and pick up your lettuce from the garden. You come and prepare it. You eat it uncooked. You can get infected. So cholera will not discriminate to you. So that is why we are saying we need to be vigilant. It's a condition that if it's not properly managed, that's why one case, as a province, we treat just one case as if it's an outbreak. Because that one case, if we don't go and teach every contact to that particular person, it will infect you. If you drink water from the river without having to follow the processes of boiling or putting jig in the water, you can drink contaminated water and you can get sick. So we can't say, no, people must not be scared that cholera. We are not saying Zimbabweans are bringing cholera. We don't want to use that. But we are saying when you go to your village where people have been infected, the chances of you to get infection with that, and if you look at its incubation period, are very high. And when you come back and you start to have those symptoms and you don't practice proper hygiene, you can spread the bacteria into everybody surrounding. But what we need to emphasize is that we can prevent cholera by practicing hygienic methods that we are teaching people about. We must emphasize the message that if we can, it's diagnosed early, we can be able to treat it. It's as simple. We just need some antibiotics to treat it. And lastly, people must know that if you miss the prevention and you miss the diagnosis and the treatment early, you can die because of dehydration, which will complicate into renal failure and quite of a number of other complications as a result of major dehydration.
All right, saying the province is ready and vigilant after 2 cholera cases. That was the MEC for Health in Limpopo, Dr. Phophi Ramathuba.